Hello and welcome. Today, we're diving into a condition that affects the kidneys, renal hypoplasia. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. Join us as we unravel the complexities of this important, yet often overlooked, condition. So, what exactly causes renal hypoplasia? Well, it's often a complex interplay of factors. In many cases, it's considered to be congenital, meaning it's present at birth. Genetic factors can play a significant role, with certain gene mutations increasing the risk. Exposure to certain medications, toxins, or even infections during pregnancy can also disrupt kidney development, leading to hypoplasia. Sometimes the exact cause remains unknown, making it a challenging condition to fully understand. Let's delve into the pathophysiology. Renal hypoplasia essentially means that one or both kidneys haven't developed to their normal size. This results in fewer nephrons, which are the functional units of the kidney responsible for filtering waste and regulating fluids. With fewer nephrons, the kidney's ability to perform these essential functions is reduced. The remaining nephrons may work harder to compensate, but this can eventually lead to damage and further decline in kidney function over time. Think of it like a factory with fewer workers trying to produce the same output. They'll eventually get exhausted. When we look at the epidemiology of renal hypoplasia, it's important to note that precise figures are often difficult to obtain as it can be underdiagnosed. However, it's estimated to affect around 1 in 500 to 1 in 2,000 live births, making it a relatively rare condition. It can occur as an isolated anomaly, or as part of a broader syndrome affecting other organ systems. Certain populations may also have a higher prevalence due to genetic factors, but more research is needed to fully understand these patterns. Now, let's discuss the signs and symptoms. Because the kidneys are crucial for removing waste and regulating fluid balance, the symptoms of renal hypoplasia can be quite varied. In some cases, particularly if only one kidney is affected, there may be no noticeable symptoms for years. However, when both kidneys are involved, or when the single kidney is severely hypoplastic, symptoms can include frequent urinary tract infections, high blood pressure, protein in the urine, and swelling in the legs, ankles, or face. In severe cases, it can even lead to kidney failure, causing fatigue, nausea, and loss of appetite. In children, failure to thrive or delayed growth can also be indicators. Diagnosis of renal hypoplasia typically involves a combination of imaging studies and laboratory tests. Ultrasound is often the first-line imaging technique, allowing doctors to visualize the size and structure of the kidneys. Further imaging, such as a CT scan or MRI, may be necessary to provide more detailed information. Blood and urine tests are also essential to assess kidney function, looking for markers such as creatinine, blood urea nitrogen, and protein levels. Genetic testing can also be considered, especially if there's a family history of kidney abnormalities. Renal hypoplasia doesn't always neatly fit into specific types, but it is helpful to distinguish between unilateral and bilateral forms. Unilateral renal hypoplasia involves only one kidney, while bilateral renal hypoplasia affects both. Bilateral cases are generally more severe and associated with a higher risk of kidney failure. Hypoplasia can also be described based on the severity of kidney size reduction, although this is more of a spectrum than distinct categories. Unfortunately, there's no cure for renal hypoplasia. Treatment focuses on managing the symptoms and preventing further kidney damage. This may involve medications to control blood pressure, antibiotics to treat urinary tract infections, and a carefully tailored diet to reduce the workload on the kidneys. In severe cases, dialysis or kidney transplantation may be necessary to maintain life. Regular monitoring of kidney function is crucial to detect and address any problems early on. Currently, there are no proven methods to completely prevent renal hypoplasia, especially in cases where genetics play a significant role. However, pregnant women can reduce the risk by avoiding known teratogens, such as certain medications and toxins, and by managing underlying health conditions like diabetes and high blood pressure. Prenatal care and genetic counseling can also help identify potential risks and provide guidance. The prognosis for individuals with renal hypoplasia varies depending on the severity of the condition and the presence of other medical problems. Some individuals with unilateral hypoplasia may live normal lives with minimal complications, while others with bilateral hypoplasia may eventually require dialysis or transplantation. Research into regenerative medicine and stem cell therapies holds promise for future treatments, potentially offering the ability to repair or even regenerate damaged kidney tissue. Scientists are also working to identify specific genes involved in kidney development, which could lead to new strategies for prevention and early intervention. The journey to understand and treat renal hypoplasia is ongoing, and continued research is essential to improve the lives of those affected.